When I tell you this story, you may never look at your private health the same way again. A 67-year-old man, let's call him Richard, walked into my office embarrassed, whispering that he had injured himself doing something most men think is harmless. He thought he was just keeping his body active, his circulation strong, and his stress down. But what started as an innocent habit ended with bruising, swelling, and weeks of pain that could have been avoided. The saddest part? He told me, "Doctor, I didn't know I could hurt myself at my age. I thought this was normal." And I realized, millions of seniors are walking around right now making the same mistakes, not realizing that something as simple as how you touch yourself could affect your bladder, your prostate, your heart, even your ability to be intimate with your partner again. Imagine carrying around shame and silence when the truth could have saved you years of pain. Before we dive in, I need you to do something important. If you are over 40, or if you love someone who is, you owe it to yourself to stay here with me. Click that red subscribe button right now, and leave a comment below, because if you click below, this noble act may save millions of seniors' lives. When you comment, when you share, you not just helping yourself, you helping thousands of men and women who feel too ashamed to ask these questions out loud. So let's talk honestly. Masturbation is normal, healthy, and even protective for seniors. Studies show that regular ejaculation can reduce prostate cancer risk by up to 20%, support better sleep, and even lower stress hormones. But after 60, the body changes. Your skin thins, your hormones shift, your circulation slows, and your prostate becomes more sensitive. If you don't adapt your habits, what used to be harmless could now put you at risk for injury, infections, or even long-term damage. And today, I am exposing the 3 biggest mistakes men over 60 are making when it comes to solo pleasure, and how to avoid them. The first mistake is using the same force and technique you used decades ago. Younger men might have gotten away with rough handling or fast, aggressive movements, but past 60, your skin's elasticity decreases by almost 25%, according to dermatology studies. That means the friction you once tolerated easily can now lead to micro tears, bruising, and in some cases, nerve irritation. Think of your skin as leather. When it's young, it stretches and bounces back. When it's older, it cracks under stress. One of my patients, Paul, 71, told me proudly, "Doc, I still do it like I did in my 20s. But when he came in for pain and swelling, we found a foreskin tear that had healed incorrectly, leaving him more vulnerable to infections. He thought he was strong, but his body had been silently begging for a gentler touch. The solution here is to slow down and respect the new reality of your body. Use a proper lubricant, something water-based or even medical grade, not just household oils that can damage skin or cause infections. And practice gentler techniques that focus on sensation, not speed. Try edging, or varying your grip, instead of forcing intensity. You'll be surprised, many men report greater sensitivity and even stronger climaxes once they stop rushing. If you agree that seniors deserve dignity and safe pleasure, hit that like button right now, because every like helps spread awareness to men who may be suffering in silence. And wait until you hear about mistake number 2, it's even riskier because it's invisible, and it could be a hidden warning sign for something far more dangerous. The second mistake is ignoring the warning signs of circulation problems. As we age, arteries stiffen, blood pressure rises, and diabetes becomes more common. All of these silently reduce blood flow to the penis. Many men over 60 think that difficulty maintaining an erection or numbness during self-pleasure is just aging. But did you know that erectile issues can be the very first warning sign of heart disease? In fact, a Harvard study found that men with erectile dysfunction have a 40% higher risk of developing cardiovascular problems within 5 years. Think about that, your body could be sending out a distress signal, and most men shrug it off. Let me share the story of Samuel, 72, who came to me complaining that his sensation wasn't like before. He thought it was purely sexual. He was embarrassed to even bring it up, but his wife pushed him to talk. When we tested him, we found severe artery blockages. If he had kept ignoring his problem, he could have ended up with a heart attack. But because he spoke up, we got him on treatment, changed his diet, added light walking, and within months, not only did his heart health improve, his private health did too. He actually told me, "Doctor, I feel like I'm 20 years younger again." This isn't rare. 1 in every 2 men over 60 has some degree of erectile dysfunction, and yet almost none of them connect it to heart health. If you feel tingling, numbness, or prolonged loss of sensation while touching yourself, don't ignore it. It's not weakness, it's your body's alarm bell. Start walking at least 20 minutes a day. Swap processed foods for circulation-boosting foods like spinach, beets, and salmon. And here's one more powerful tip: stay hydrated. Dehydration thickens your blood, making circulation worse. Something as simple as drinking enough water can improve performance. Now, I want to hear from you in the comments. Do you believe seniors should treat self-pleasure as part of their health check? Your comment might inspire another man to see his doctor before it's too late. And in mistake number 3, we uncover a habit that sounds safe but may actually put your prostate and bladder at serious risk. The third mistake is overusing adult aids without understanding the risks. Many seniors turn to toys, pumps, or even tight devices to make up for lost sensation. On the surface, these tools can seem harmless, but used incorrectly, they can lead to dangerous pressure on the urethra, infections from unclean materials, or even damage to the prostate. A man in his early 70s once came to me after using a vacuum pump every night for months. He thought it was strengthening his erections. But instead, he had burst tiny blood vessels that left him with painful swelling. Another patient admitted to using tight rings far longer than recommended, leading to reduced blood flow and scarring. The truth is, your body after 60 is more delicate, and what feels helpful can backfire if you don't use it wisely. The safer path? If you do use devices, make sure they're medical grade and approved, not cheap knockoffs from unverified sellers. Clean them properly. Unwashed aids are a breeding ground for bacteria, and urinary tract infections rise sharply in seniors. And most importantly, limit time and intensity. Think of it as exercise, controlled, moderate, and respectful of your body. Don't be afraid to alternate with natural methods. Gentle massage, guided breathing, mindfulness, and pelvic floor exercises can restore sensitivity and strength without risk. Seniors often underestimate how much pelvic exercises, like Kegels, can boost pleasure. Men who practice them regularly report stronger, longer-lasting function even into their 80s. If this insight opened your eyes, hit that like button and let's get this conversation moving across the country. Seniors deserve safe, healthy, and shame-free intimacy. And here's the teaser: most men think avoiding infection is just about cleanliness, but there's a hidden risk tied to your prostate that I'll reveal when we continue. You won't want to miss it. Now that you know the 3 biggest mistakes, forceful technique, ignoring circulation warning signs, and misusing adult aids, you're already ahead of most men your age. But this is just the beginning. Before you go, let me remind you, click subscribe right now, and leave your comment below. If you click below, this noble act may save millions of seniors' lives. Don't keep this knowledge to yourself. Together, we can break the silence, protect dignity, and give every senior the chance to live and love fully. Most men think avoiding infection is just about cleanliness, but here's the truth. After 60, infections linked to self-pleasure aren't just about hygiene, they re-tied directly to your prostate and bladder health. The urethra, the small tube that carries urine and semen, becomes more vulnerable as you age. If bacteria enter this channel, they can climb quickly to the bladder or even the prostate gland. And that's the shocking part: prostatitis, an infection or inflammation of the prostate, is one of the most common urological conditions in men over 60. According to the National Institute of Diabetes and Digestive and Kidney Diseases, prostatitis accounts for 2 million doctor visits in the US every year. I remember a 68-year-old gentleman, George, who came to me after weeks of pelvic pain and difficulty urinating. He thought it was just age. But when I tested him, he had a severe prostate infection, triggered by using unclean aids. He had been silently suffering because of something completely preventable. The solution? Always clean any device with warm water and antibacterial soap, dry it properly, and never share. And if you prefer natural methods, simple hand hygiene before and after self-pleasure reduces infection risk dramatically. Gentlemen, this is your cue. Leave a comment below. Do you believe prostate infections are being overlooked in senior men? By sharing your opinion, you might empower another man to seek treatment before it's too late. And in a moment, I'll reveal how emotional health ties directly to your physical pleasure. You might not expect what I am about to share. Now let's talk about the connection between loneliness, stress, and how your body responds. You might not realize this, but emotional health can make or break your sexual health after 60. Chronic stress raises cortisol, a hormone that lowers testosterone and reduces sensitivity. Loneliness, which is sadly common in older adults, can amplify depression and anxiety, further reducing desire and satisfaction. A study in the Journal of Sexual Medicine found that men who reported high stress levels had a 62% higher chance of experiencing erectile difficulties. One of my patients, Walter, 75, lost his wife and stopped engaging in intimacy completely. When he eventually resumed self-pleasure, he found he couldn't reach climax and feared something was broken. But what was broken wasn't his body, it was his spirit. With counseling, regular social interaction, and simple stress relief techniques like deep breathing and light yoga, Walter not only regained his function but also his confidence. The practical tip here: treat intimacy as part of your emotional self-care. Combine relaxation rituals, like a warm bath or calming music, with your private moments. It lowers stress and boosts your natural response. If you agree that emotional wellness is just as important as physical health, hit that like button. Every like helps raise awareness that intimacy is about mind and body together. And next, we uncover a powerful exercise that most seniors overlook, yet it can dramatically change your ability to enjoy pleasure safely. One of the most underestimated tools for safe, satisfying intimacy after 60 is the pelvic floor. These are the muscles that support your bladder, prostate, and sexual function. Most men ignore them until problems arise. But that's the kicker. Research from the University of West England shows that pelvic floor training improved erectile function in 40% of men who practiced regularly. That's nearly half of men seeing a noticeable difference just from a simple routine. Take Frank, a 69-year-old retired teacher who came to me convinced he needed medication to perform again. Instead, I taught him daily pelvic exercises, tightening the muscles as if holding in urine, holding for 5 seconds, and repeating 10 times, twice a day. Within 3 months, Frank told me, "Doc, I feel stronger, and I don't need pills anymore." That's the power of retraining your body. For seniors, this isn't just about performance, it's about preventing incontinence, protecting your prostate, and extending intimacy well into your 80s. My challenge for you: try these exercises daily for 30 days and notice the change. And let us build a community. Share in the comments if you tried pelvic training, and what difference it made for you. Your story could encourage someone else who's silently struggling. But don't go anywhere yet, because in just a moment, I'll show you how small lifestyle changes can multiply all of these benefits and keep your private health thriving. Let's close with a powerful reminder. You've now seen the hidden dangers, rough techniques that can injure thinning skin, circulation issues that signal heart disease, misuse of aids that damage the prostate, infections that creep silently, stress that steals desire, and the neglected pelvic muscles that could transform your experience. But you've also seen the hope, solutions that work at any age, from simple hydration and healthy food to relaxation rituals and muscle exercises. You don't need to give up intimacy because of age. You just need to adapt, protect yourself, and embrace these safer, smarter methods. So here's my final call to you. Don't leave this video without taking action. Click subscribe right now so you never miss the health secrets that could save your life. Leave a comment below with your thoughts, your story, or your advice, because if you click below, this noble act may save millions of seniors' lives. Imagine a world where no man over 60 has to suffer in silence, where dignity, pleasure, and health go hand in hand. Together, we can make that world real. This is your moment. Take it.